The Ministry of Health has released a public statement which I don't know if everyone has gotten a chance to read or understand, but I'm just going to read it as it is, so that if you haven't heard or read about it or seen it, at least let me read it for you. It's the official statement from the Ministry of Health, and I'm just reading it for you so that you can know what's happening and how you can take precaution, how you can take care of coronavirus in your neighborhood and in this country. So the statement reads: the Republic of Uganda, Ministry of Health. The do's and don'ts of coronavirus disease in brackets COVID-19. Background: an outbreak of coronavirus disease COVID-19 was declared by the People's Republic of China on 31st January 2020. This outbreak has now spread to all continents, and 46 countries are currently affected. Many others may be affected too. In Africa, Algeria, Egypt, Nigeria have already reported cases. The possibility of spread to other African countries, Uganda inclusive, is extremely high. Although Uganda has no case of COVID-19, it is pertinent that the population remains on high alert and diligently exercise preventive measures to avoid contracting disease. The Ministry of Health has developed the following do's and don'ts to educate the public on how to avoid contracting the disease. So the statement further reads: what is coronavirus disease, COVID-19? This is a highly infectious disease caused by the new coronavirus COVID-19. It is spread from person to person through sneezing or coughing, in brackets droplets infection, human to human contact, and contact with contaminated surfaces. Signs and symptoms of COVID-19: 1. Fever. 2. Cough. 3. Sore throat. 4. Difficulty in breathing. 5. Other flu-like symptoms like running nose, sneezing, and body weaknesses. Let me repeat for the benefit of everyone. This is a statement issued by the Ministry of Health of Uganda, official statement. The symptoms are fever, cough, sore throat, difficulty in breathing, other flu-like symptoms like running nose, sneezing, and body weaknesses. The statement further reads: what must be done to protect oneself? In brackets, things to do. 1. Wash your hands frequently with soap and water, or use alcohol-based hand rub. This will remove the virus if it's on your hands. 2. Cover your mouth and nose with tissue or handkerchief when coughing and sneezing. Throw away the used tissue immediately and wash your hands with soap and water, or use alcohol-based hand rub. The handkerchief must be washed by yourself daily and ironed with hot iron. In this way, you'll protect others from any virus released through coughs and sneezes. Maintain reasonable distance between yourself and someone who is coughing, sneezing, at least 1 meter apart. 4. Avoid touching your eyes, nose, and mouth. Hands touch many surfaces which can be contaminated with the virus, and you can transfer the virus from the surface to yourself. If you have fever, cough, difficulty in breathing, seek medical care immediately. If possible, call a health worker and alert them about your condition. Always follow the guidance of your healthcare worker. People with flu symptoms should use face masks to cover the nose and mouth and stay home with a well-ventilated room. 7. If you are caring for individuals who have symptoms such as cough and fever, you are encouraged to use a face mask to cover your nose and mouth for personal protection. 8. Clean and disinfect frequently touched surfaces such as doorknobs, handles, car doors, elevator buttons, etc. daily with regular household disinfectant, soap and water. 9. All travelers coming from countries affected by the coronavirus disease should follow guidance given by health workers at the airport and other border entry points. Meanwhile, this is the official statement from the Ministry of Health of the Republic of Uganda, and I'm reading it as is for some of you, my followers, who may not have seen it. Then, so what must be done? 1. Avoid handshaking and hugging at all times. This one is in capital letters, it's in caps and bold. Avoid handshaking and hugging at all times. 2. Avoid close contact with people who are visibly sick with flu symptoms, that is fever, cough and sneeze. When sick with flu symptoms, avoid going public places, office, public gatherings. Remain at home to avoid infecting others. 4. You do not need to wear medical masks if you don't have respiratory symptoms such as cough, sneezing or running nose. 5. Do not take self-medication such as antibiotics. 6. Do not spit in public. Find a scheduled place like toilets or latrines in which to spit. 7. Delay travel to countries that currently have many patients with coronavirus disease. If you must travel, please follow the above protective measures. 8. Avoid travel if you have flu-like symptoms. Now, the concluding statement is the public is also advised to report any suspected cases to the nearest health facility or call our toll-free lines on 0800 203 033 or 0800 100 066, or the following officers: Mr. Atek Kajirita on 0782 909 153 or Dr. Alan Muruta on 0772 460 297. I thank you. That's the end of the official statement issued by the Ministry of Health of the Republic of Uganda, cautioning citizens against coronavirus. So now, guys, I urge you, friends, followers, to look out for this statement wherever it is and take precaution. There's one thing I saw here: avoid hugging, avoid shaking hands, report any case. We can live in a safe place as responsible and careful people. So let's try to be careful in this time, and I urge you to remain vigilant. Maybe report any case, isolate yourself if you've traveled from those countries. Basically, be on the lookout. This is not the time to relax. No, let's be on the lookout. As the statement reads, let's be on the lookout. Of course, the ministry we can't say they'll be everywhere. We need to help them to help ourselves. I thank you so much. God bless you, and stay safe. Bye bye.